So our therapists and our coaches work from the betrayal trauma model for partners who've been impacted by somebody else's compulsive behavior. We don't look at it through a codependent lens, and there is a difference between being a partner of an alcoholic or a drug addict and being a partner of a person who's acted out sexually. And that is with, in the old model of when we looked at codependency, many times partners of alcoholics would pour the booze out of their husband or their partner, or they'll call in sick for their loved one, and which was blocking the natural consequences of that person's for that person getting the help that they need. But partners of sex addicts or people who are acting out sexually, they don't know what's happening, and so they're not covering up for their partner. They are absolutely blindsided, and when they're blindsided, it's called Discovery Day. And when they discover they are experiencing PTSD symptoms, they get completely blindsided and they experience betrayal trauma, which impacts their brain. And the symptoms, there's been studies to show this, their symptoms are consistent with symptoms of PTSD. So when we're treating them through that lens rather than through the lens of looking at how they picked, why they picked the person or their family of origin. We're actually looking at it through a betrayal trauma lens. Now sometimes partners have some trauma from their background, or they may have codependency from their childhood. And it's not to say we don't address that, but we certainly don't start there. Where we start is to help them with their betrayal trauma. So the process of treating betrayed partners is the first thing is to really hear their story, to validate them. I mean, oftentimes they've been lied to for so long and gaslit and made to feel crazy that the very beginning part of treatment is just to really hear them. We also have assessments for partners that they can take to really validate their experience, and many times that what comes out of the assessment is they have PTSD symptoms, and then we start treating them for PTSD symptoms. And the ways we treat that is we use EMDR. There's other trauma methodologies that many of the therapists use to help partners with betrayal trauma. We give them, we teach them skills on how to self-regulate when they're triggered. We work a lot with self-care to just really teach them how to take care of themselves, how to set healthy boundaries for themselves. And then once we get them stabilized, then we start moving them forward through the process to figure out what it is they need to take care of themselves, whether or not this relationship is working for them. If their husband gets into recovery or their partner gets into recovery, we do boundaries work, and then oftentimes we go into what we call a reconciliation process, where their partner will do a disclosure with the therapist present in order to really for them to get the information they need. We have them do an impact letter to their partner so that way he understands the pain he's caused her, and then we also have him do a clarification letter or an amends type of letter, accountability letter to her, to really show her how he got away with it, how he lied, how he cheated, his distorted thinking. This whole process helps them move through this trauma and helps her move through this trauma. The important piece with her is to really identify that she didn't do anything to cause it. It wasn't her fault, to get her the support that she needs through therapy. We also have groups for women, partners-led, therapist-led groups for women. There's 12-step community for women to help them, to support them, and to move them through this process.